So you have been searching for facial nerve anatomy. You are in the right place. In this video, we will be explaining the understanding of the facial nerve. See, here in this video, you won't be memorizing anything. You will see and understand. It will be, if you stick with this video till the end, you will remember this your entire life. Till the time you have memory, you are going to remember this. And we are not trying to memorize, like you memorize multiplication table, raw memories, right? We are not doing anything. We just trying to understand from where it is coming, that facial nerve coming, and giving the supply and making my face move. All right. So we have done another video on facial nerve, which we were talking about the different peripheral branches of the facial nerve. But in this video, we are seeing from where my brain the facial nerve is originating, the upper motor branches, the lower motor neuron, from where it is coming, upper motor where it is coming, and where it is coming and exiting and giving supply to my face. And all these things we are going to see. It will be a long video, but stick with me. Take your notes, take your pen, and try to make notes. From this point, we will start. I will be sharing my screen and the notes I have taken, right? So let's get into the facial nerve. So as you know, we all know the peripheral branches of the facial nerve. So this is the temporal region. This top part we call it as a temporal. This is the zygomatic region. This is the buccinator. This is the marginal mandibular part, and this is the cervical. All are supplying from the motor branches of the facial nerve, right? And what are the sensory? Sensory supply will be anterior 2/3 of the tongue, right? Sensation you are getting from that is facial nerve. The taste sensation from the anterior 2/3 of the tongue is from the facial nerve. Then we have posterior part of the ear, we getting sensation, that is also from the facial nerve, but different nuclei. We will see all that. Alright, and what else? There is autonomic function. You are crying. When you cry, there is facial nerve part is there. Tears will come from you. That is facial nerve. Then you have saliva production from when you eat food, you are getting nice saliva, right? That is lacrimal gland, submandibular gland is there, right? So different glands there, facial nerve is supplying. That is autonomic function. So these are just the basic. And in the last video, we also talked about how to differentiate between a stroke and Bell's palsy. So we started all of this from Bell's palsy condition. Now let's see from brain where it is starting. If you see the brain homunculus, you can see this picture, right? This picture, you will be familiar with this picture, that different area of our brain represent different part of our body, right? So in that area you see where it is, the face is coming the frontal lobe. Frontal lobe will be here. The primary motor cortex, where it is, primary motor cortex area around this area, in my frontal lobe, this is my frontal lobe, around this area, different part is representing. So this inside part will be, this part inside this cut, right? This area will be representing, this cut area will be representing my leg. Then it comes my trunk. Then large area is applying my hand. Most of the area is applied by the hand. Then comes the face. Huge area. Facial, this area is applying by huge. It comes the lower part of the frontal brain, the frontal lobe of the frontal lobe of our brain. So it usually around that area it is coming. If you see this yellow thing, right? So that is the primary part of the facial nerve is coming. The facial nerve, it is not facial nerve, that primary upper motor neuron is coming. And see where it is. So our brainstem is divided into midbrain, pons, and medulla. So if you see that it is coming, this line is the facial nerve. 1 minute, I will put my then you show from the brain it is coming. And it coming to the, where is this? This cortico-bulbar tract is in the bulbar tract related to our facial muscle, our eye muscles, all these we call it as our swallowing muscles. All these are coming to the bulbar tract, we say. So it is in the which part? First we are seeing this is the midbrain. From midbrain, and it comes to the motor nuclei of facial nerve, pons. So the facial nerve existing from which part of the brainstem? It will be the pons. You have seen this picture multiple times. From the pons, it is facial nerve is coming out, right? This is just a this is just to give you understanding what is happening. So from the my frontal lobe, the primary motor cortex area, it is coming down, pass through internal capsule, coming down to the midbrain where bulbar tract, through the from cortex to the bulbar tract, going to the pons. Next is pons. So here it was midbrain, then comes the pons. From the pons it existing out, and that is the, you see outside, facial nerve, right? This yellow line is the facial nerve. So from the pons it exists out, right? And the other side you are seeing other tracts that usually comes right in the this is medullary tract. So that is the usual tract that goes, but here facial nerve that is applying here in the face muscles, motor movements, and is coming from the, just understand this, coming outside of the pons, and it is from the frontal lobe in the primary motor cortex. This is just an idea of the starting point, right? Now we will go to the top and understand the ideas of the facial nerve, what is happening. So this picture you see right here, what is this? This is the cerebellum. This flower type thing, that is cerebellum. This flower type, this is the cerebellum, and this thing right here, it is the pons. From the pons it is coming. Look at the facial nerve is 7th cranial nerve, that yellow cranial nerve coming out of the pons. So just understand that from my frontal lobe, primary motor area, there is different representation of the body parts. From the facial part, around come down area, facial homunculus of the different part of the body is representing by different part of the primary motor cortex area. From there it is coming down and giving to the midbrain, cortico-bulbar tract, goes through down, come to the pons, exit to the pons. Now it's not that easy, like just exit out of facial nerve. It's not just existing out of the pons. There is different nucleus. I told, right? It's just not the motor brand. There is autonomous functions. There is sensory functions, right? So now let's look at what is happening here. So in that pons, so if you see this part is the pons. This is the cerebellum. And this is the back part. You can see the cerebellum. Here is the fourth ventricle. This is the medulla. This is the pons. Midbrain, pons and medulla, right? This is midbrain, pons and medulla. Look at the pons. Facial nerve is coming outside of the pons, right? But if you see, there is different structures I have drawn. Now you will understand what are they. So if you want a nerve to come out, there should be a nucleus will be there, right? Every nerve will be coming from a small nucleus. I will see it like a a button, like a pinpoint. Like if this is a nucleus, from the nucleus nerve will exit. So like that, if it is the pons from the front part you are viewing, this is the pons from the lateral. If it cut down and you seeing it from the lateral side, so this entire area is pons. Facial nerve is coming out, but different nuclei are there. Why different nuclei? Because it is related to motor function one nuclei, autonomic function one nuclei, then sensory function other nuclei, right? Now what are these nuclei? So first you understand the names, okay? Nucleus of tractus solitarius, brachiomotor nuclei, lacrimatory nuclei, and salivatory nuclei. 4 nuclei in the pons related to the facial nerve. 4 nuclei in the pons related to the facial nerve. Nucleus of tractus solitarius, right? Then we have brachiomotor nuclei, which is the motor function, which is supplying the facial muscle. Lacrimation, what will be the function? And salivation nuclei. Now you need to see where are these nuclei is actually sitting, right? I have a picture drawn for you to understand that. Okay, see this picture, okay? The yellow, first you see this yellow color thing. This you see. So this is the pons part from the lateral side you are seeing. I told there is different nuclei. So the first nuclei you will see is the motor, brachiomotor nuclei. That is this thing, yellow thing. That is the yellow thing. I will put in yellow color and show you. So this thing, this yellow thing coming out, that is the motor branch. That nuclei, the facial motor nuclei or the brachiomotor nuclei in the pons is giving supply to facial branch of motor supply. That means if I move this facial expression, is that because the impulse is coming from the facial motor nuclei in the pons, right? So that is the motor branch. So understand this, there is different branches of the facial nerve. Autonomic is there, which is coming to the crying, right? Saliva, that is autonomic. Then motor branch, which is movement of the face. Then there is sensation, tongue and back of the ear. But this motor branch, this motor moving ability is coming from the facial motor nuclei or the motor brachii nuclei, same thing, coming from the pons in the facial motor nuclei. That is distinct. This is coming around, and if you see, it comes and winds around nerve, abducens nerve. Abducens nerve is supplying to the lateral rectus muscle, which is supplying the eye. Around the eye, in the lateral side, there is muscle that is supplying the abducens. So the facial motor branches winds around the abducens and comes forward, exit through the pons. That's picture you saw here, right? Exiting out, see, from the seventh nerve, see, from that winds around and this motor branch exit out of the pons. That's how it is existing out. There is nucleus in the pons. Next is the superior salivary nucleus. Superior salivary nucleus is which one? So saliva is related to what? My tongue related. 1 minute. Salivary nucleus is my saliva and my lacrimal thing. It both we call it as salivary lacrimal. We can call it a salivary lacrimal also. So where it is coming, the nucleus is a little behind that facial. This blue thing, this blue part is the nucleus for the salivary and lacrimal. Superior salivary nucleus, a parasympathetic fiber to lacrimal and submandibular and sublingual glands. To the eye, here there is lingual. This is lacrimal, mandibular and sublingual around below the tongue. So around the mandible area, around the tongue, sublingual, submandibular and the lacrimal. So these are glands. There is different glands in these three areas. For these three areas, there is a parasympathetic, which is autonomic branch is coming from the superior salivary nucleus. Two nucleus, one facial motor nuclei, superior salivary nucleus. Superior salivary nucleus is giving supply to three glands. Lacrimal gland, which is eye crying, submandibular, sublingual. Right. So two nucleus is done. Now solitary nucleus. Solitary nucleus is this red guy. I already drawn the tongue. This here it is the solitary nucleus. Solitary nucleus is related to our taste sensation. I told to anterior 2/3 of the tongue, it is related to the taste sensation. That sensation is coming from this nucleus right here. Then the last is this green color. Look at that green color, big guy here, right here, big guy. This is the spinal nucleus. So the tongue is from the sensation is from the solitary nucleus, and the back of the ear, I told, right, there is sensation supplies there. That is one single nucleus that is called as the spinal nucleus of trigeminal nerve, right? So there is 4 different nucleus. Superior salivary nucleus is there, facial motor nucleus is there, then related to the tractus is there, solitary tractus solitaris is there, which is related to the tongue. Tractus solitaris, you understood, right? Related to the tongue. Then there is trigeminals, spinal nucleus of trigeminal nerve. It is supplying the posterior part of the ear. Last one time I am telling you. From the brain it is coming, and then it exists out of the pons, right? But pons, there is different nuclei for the facial nerve. Why? because there is different function for a facial. Those not just a facial based muscle movement, right? So the facial movement is from the motor nuclei, facial motor nuclei. Crying is a parasympathetic, autonomic. It is from the superior salivary nucleus, that is in the lacrimal, submandibular and sublingual. Then we have tongue, that is practice of solitarius nucleus in the bones and in 2/3 of the tongue sensation. Then we have last in the posterior part, spinal nucleus of the trigeminal nerve, that is the posterior sensation. So these are the basic nucleus in the bones. Okay, now we will continue with this facial nerve. See, the nucleus I have been talking about, I have drawn this again here so you can understand and see the better picture. So the seventh, the yellow one right here, I will choose yellow color. This yellow one right here is the motor branch, the brachiomotor branch, the facial motor branch, which is supplying the facial muscle. Not only the facial muscle, one more muscle it is supplying, not one more muscle, few muscle more. Stapedius muscle, which is stabilizing the stapes bone. Then some of the here posterior digastric and stylohyoid muscle, right? And for helping the muscle that helping in the chewing and swallowing the food and all that. So that nucleus is coming from the bones. This yellow color is that motor branch. Right. Next, there is a green color carrying, that is lacrimal, that parasympathetic. Then nucleus of tractus solitarius, nucleus NTS, right? This is the nucleus of tractus solitarius, that is giving anterior 2/3 of the tongue sensation. Then a big guy in the back, that is superior spinal nucleus of the trigeminal nerve, right? Spinal nucleus of the trigeminal nerve. Trigeminal nerve, but it is we're calling it that name, but it is actually supplying the posterior external auditory canal. Now, see, one mesh you can see, right? One tube is forming with the 3 nerves, that 3 nucleus. It doesn't have motor nucleus. So it has lacrimal, superior lacrimal nucleus is there. Nucleus of tractus solitarius is there. And the trigeminal nucleus is there in that new nervous intermedium. So that mesh, that put together a system called nervous intermedium. So the principal nucleus, which is the motor nucleus of the facial nerve, is seen in the lower pontine region. And this is the pons. In the lower part of the pons, you are seeing this. Exists at the pondo-medullary junction. So midbrain, pons and medulla. So between the pons, if you see here, you have one. So this is the pons. This is the pons. This is the medulla. So in the medulla pondo-medullary junction, this is the facial nerve existing. Pondo-medullary junction, facial nerve is coming out. The facial nerve has parasympathetic fibers, help in lacrimation, salivation originating from the superior salivary nucleus, which is this one. This is the superior salivary nucleus. Nucleus of tractus solitarius in the taste sensation, anterior 2/3 of the trunk. Nucleus are the end point of the sensory. So, from when you consider this thing, right, taste sensation, it is not coming out. All others are coming out. But here, from the sensation, taste sensation is going from our tongue anterior 2/3 to this nucleus tractus. So, it will be like this. It is going in, nucleus of tractus solitarius. The sensation is going in. From the tongue anterior 2/3, it is going to the 2/3 to the tongue to the nucleus tractus solitarius. Salivary nucleus give fibers to glossopharyngeal nerve also, that don't go that deep, right? So that is the basic nucleus and where it is going. Touch pain temperature fibers from the ear. Posterior part external auditory meatus, I told, is from the trigeminal system. See here, read this. Touch pain temperature fibers from the ear. Posterior part of the external auditory meatus come from the mesencephalic nucleus or principal sensory nucleus or spinal nucleus of trigeminal. This is different names for it. Okay, we will stick with this name. Spinal nucleus of trigeminal nucleus system. Spinal nucleus of trigeminal. Oh my god, I don't want to write again. Nucleus system. So don't confuse it is with the trigeminal nerve. It is a facial nerve nuclei that is supplying posterior part of my ear, and that will not touch sensation, touch, pain and temperature. It all comes from this part. So one thing you need to focus here, it is this one name, nervous intermedium. Nervous intermedium is a mesh like a tube. Three nucleus are coming. First the superior salivary nucleus is autonomous, then the posterior part of the spinal trigeminal nucleus, and the one more tractus nucleus of tractus solitaris. But the motor branch is going out of this nervous intermedium, right? That is the nucleus part what you need to know. Now we got the idea, and from the poles it is coming out. So from here, frontal part of my primary cortex, the homunculus part, my facial part is in the lower area. It came down to the medulla, where pontine, the cortex, bulbar, corticobulbar tract. So the corticobulbar tract came to the pons. Different nucleus are there coming out at the pontomedullary junction. It comes out of the pons. Now where it is going, right? So it is going to the around this area. It will come out of the ear and come out of here and give. So ear area it is traveling. Ear canal it is actually going. So to enter the ear canal, it is going inside something called internal acoustic meatus. So in this picture you can see it is going. This facial nerve actually coming down from the. It is coming down from the this part, more pontomedullary junction. It goes to the internal ear part. So ear canal it is entering, and that entering point is the internal acoustic meatus. So that small opening, internal acoustic meatus, it enters through the ear. So once it enter ear, and it goes through the internal ear canal and come out through a small opening here called stylomastoid foramen, and then it gives the different branches to the muscles of the faces, right? So once you understand the Bell's palsy, two area this facial nerve can get inflamed and get imaged. One of the areas is facial canal, and the second area is the stylomastoid foramen, this small opening. So now this internal acoustic meatus is just an opening to enter the facial canal. Let's see what is facial canal. Facial nerve through auditory canal reach, auditory canal. Through auditory canal reach the middle ear. So this is this tube, right? This tube, right? That is the auditory canal. Through that way it reach internal acoustic meatus. It reach enter the middle ear. So through the facial canal, which is an opening, is the internal acoustic meatus. Through that it reach where middle ear. Middle ear is in that area. If you see. So it is coming to the middle ear part. This thing is the facial nerve. Facial nerve is traveling through the canal, auditory canal, reaching the middle ear, and it is supplying where? I told there is one muscle called stapedius. So this muscle right here is the stapedius, and it is stabilizing this. This is the stapes bone. So this nerve supplying this motor branch. The motor branch, I'm talking about the motor branch right now. It is supplying the stapedius muscle, which is stabilizing the stapes bone. Why it is important? Now, why it is important to stabilize the stapes bone? If you don't stabilize the stapes bone, there is going to be a lot of vibration in that, and even a small sound you are hearing is heard as a loud noise, and it started to irritate you. So that's why motor branch has important role in our voice recognition, or voice, irritation, something from the middle ear. So from the pontomedullary junction, it came to the internal acoustic meatus, auditory canal. From auditory canal entered the middle ear. It supplied to the stapes bone through the stapedius muscle. It stabilized, right? Exits the middle ear and come to the stylomastoid foramen. So I want you to see that picture. You need to see. This is my ear. Inside this here is the from here it came all down pontomedullary junction. It came, and then it goes to the internal auditory canal. From auditory canal it came to middle ear, gives supply to the stapedius bone, and then slowly come down and come out through a foramen here. Right here it will come out. Right here That is the stylomastoid foramen. That is you're seeing here, the stylomastoid foramen, it is coming out. Now from stylomastoid foramen, it is branching out. The temporal, the zygomatic, the buccinator, the mandibular, the cervical. See different branches here. Temporal branch, zygomatic, buccinator, mandibular, and the cervical. And it is supplying different glands also. The posterior part is posterior auricular part. This is supplied by which nucleus? Spinal trigeminal nucleus or nucleus trigeminal system. Now that is the way it is coming out. This coming out. Taste fibers are from nucleus of the tractus solitarius. Same thing, okay? Now I want you to understand certain things that is related to this. So usually that is anatomy. You got the anatomy, you got the picture how facial nerve is coming. Now you need to understand this thing. When Parkinson's is there, right? Let's say you have a facial paralysis. Don't talk about Parkinson. You have a facial paralysis, Bell's palsy, a patient is there. So full side weakness is there. But suddenly you saw some facial expression is coming. Do you know why is that? Because even though that complete motor branch is inflamed and impinged and not there, but there is some function in the face that is involuntary, that emotions are what causing that movements. That we call it as the limbic system or extrapyramidal system is there. So that nerve is actually involuntarily functioning our expressions. Like we don't control them, we don't put them voluntary actions. So if you are not using the voluntary action, then it is an extrapyramidal tract. So this extrapyramidal supply is there for the facial nerve. It's exciting. And when you understand is this, Parkinsonism, as you know, is an extrapyramidal involvement. And if you see Parkinsonism, they get a staring face. That the staring eye is there. And the masked face, that is the correct word. That they look like this. They stare the eyes, they don't have any expression because they have problem with this extrapyramidal tract, and this part of the facial part is affecting. So limbic system is corticobulbar pathways involved. There's a loss of emotion can be there. Occasional emotional expression, limbic extrapyramidal pathway control. Occasionally it is affecting. Occasionally it is controlling. The extrapyramidal system is controlling our emotional movement that is not voluntary. And this limbic extrapyramidal pathway control, involuntary automatic facial expression. In Parkinson, staring eye, damage to the limbic supranucleus input, emotional facial expression, but voluntary movement again. And this thing, right, they're complete okay with voluntary movement, but the emotion part, they suffer. So if you ask them to close their eye, they can close their eyes, but emotions are not coming out because this extrapyramidal, the limbic system, there is a problem with that. Limbic pathway, there is a problem with that. And this is I thought this is a tool factor which you need to know. So just to see this picture, okay, this is the motor, this is the pons. There is a nuclei, that is motor nuclei of the facial nerve coming. That what is that orange? Orange is the which nerve? Abducen nerve is lateral rectus muscle coming to the eye muscle. From there it came down to the in auditory canal, internal acoustic meatus, then middle ear, extending to stylomastoid foramen. Stapedis must be stabilized. This is the stylomastoid foramen. Stylomastoid foramen. Here is the internal acoustic meatus coming down. This is stapedis bone is there, right? This is the external part coming different branches. So this is the facial nerve anatomy. This is the facial nerve, all you need to know. So if you have this picture, where it is going, why it is coming in, why there is problem related to the facial nerve, you know Bell's palsy now. You know what is difference between stroke and Bell's palsy. And you know what is Parkinsonism. They are able to do voluntary, but emotion is affected. Facial muscle. We are ending it today here. The facial nerve we are ending it today. This is close to me. I have seen patients who are suffering from Bell's palsy, that one day you will lose complete ability to move your face, and that is a hard place to be. As we started our video, I wanted to tell you, once that inflammation comes down, if you are a patient who is suffering from Bell's palsy, it is going to improve. And understanding these anatomy as a physiotherapist will help us to treat and make, that inner vision is there. When you have that inner deeper vision from where nerve travels and supplying all these things, you will know other problems, not just the muscle weakness, that other related problems along with this. So I hope this video help you. Hope you never forget this anatomy of the facial nerve. And if you like this video, you want more, please consider subscribing and share it with your friends about this facial nerve anatomy. Therapist level. Keep moving and stay healthy.